All right. I want to thank everybody for taking time out of your busy schedule today. Today, you're attending RMTAC's, which is Resource and Empowerment Technical Assistance Center for Behavioral Health Training. And our training today is called Recognizing and Responding to Domestic Violence, the Power and Control Will in Refugee and Migrant Contexts. So I want to thank everybody for, again, taking the time out of their busy schedule to come here today. Our agenda for today is we're going to be we're going to do a welcome and introduction. We have the learning objectives, why this matters, some key points we're going to be going over, the core concept explanation, the application of the will. So you're going to actually see the will applied in real life scenarios, a case study, some practical strategies, common mistakes that you see amongst providers, resources and references, and closing reminders, as well as the Q&A and a survey. And again, I want to welcome everybody. My name is Olivia Baylor. I'm a licensed clinical professional counselor, a national certified counselor, and a board certified telemental health provider. And I'm joined today by Esther Rodriguez, who's actually in the chat area. And they hold a master's degree in mental health counseling and brings expertise in program coordination and community engagements. Now, before we begin, I want to clarify that this training is facilitated by licensed professionals, but it is intended for educational purposes only, and it does not replace any individualized consultation, supervision, or clinical decision making to your specific caseload or clientele that you'll be working with. All right, so our learning objectives for today is going to be how to define domestic violence and its core dynamics, including the power, control, and coercive behavior within diverse relationship contexts. We're also going to be describing the impact of DV on immigrant and refugee survivors, including the legal, cultural, linguistic, and trauma-related barriers to safety and recovery. We're also going to be identifying trauma-informed principles that reduce that risk of re-traumatization and support survivor empowerment and service delivery. We will also recognize the role of cultural humility and intersectionality when supporting these clients from a historical marginalized or displaced communities. And by then, you'll also be able to apply at least 3 engagement strategies that really do promote that client autonomy and safety during DV interventions, including in-person and virtual settings. And finally, we will be evaluating the importance of collaborative safety planning and identify alternative language and methods to increase that survivor control and participation. All right, so as a reminder for this training, we will be discussing topics that are related to domestic violence, abuse, and trauma. And these discussions may evoke a strong emotional response or memories. So please take care of yourself throughout this training. You're welcome to step away, turn off your camera, or take a break at any time. And if you need support, please let us know you're not alone. We encourage you also to reach out to any type of supervisor or support networks that you have, or a mental health professional if needed. So before we dive in, I do want to ask just one question just to see where everybody is. What challenges do you think make domestic violence harder to detect or report amongst immigrant and refugee communities? It's just what we do in our culture, fear of cultural bias and reporting. Yes, that cultural perceptions, language barriers, these are all really good ones. Um, yes, fear that it will affect their immigration status. So I'm seeing a lot of people that have already started working, it seems like, with the DV community, and I already have a little bit of a history of seeing these patterns as some barriers that they have with seeking out help. Okay, great. These are great responses for everybody. So I want to thank everybody who shared, and you can still continue to share in there. Um, and these are all really important insights as they really do highlight some of the key challenges that we can make that can make domestic violence reporting harder for our clientele and offer also for us to be able to be difficult to actually recognize. So let's really take the time to now explore why this issue is essentially significant when working with refugee and immigrant populations. Okay, so first let's start off with why does this matter? Why is it important? So when we're working with refugee and migrant populations, it's really essential that domestic violence doesn't exist in a vacuum, and we have to understand that. It's not about two people in a relationship, it's about a web of cultural, legal, and systemic barriers that shape the survivor's ability to recognize abuse, name it, and even seek that support. So, for many survivors who are migrants or refugees, just simply identifying that they're experiencing domestic violence is not very straightforward. The language that we may use in Western countries to describe abuse, terms like emotional abuse or coercive control or financial abuse, may not even exist in their native language. Or if they do exist, they may not be actually framed as abuse. So instead, these dynamics might be seen as normal or expected or even necessary for the survival of the family or the community system that they have. And so we as providers working with this population have to acknowledge that survivors will face multiple overlapping forms of oppression. So that includes racism, xenophobia, language barriers, and economic inequalities. Many are really navigating these unfamiliar systems, possibly even without documentation, and are unsure of what protections they actually have. So, if any protections, and they may not trust the police, as stated in a couple of responses, they may not trust the police or social services due to past experiences in their home countries or even during their migration journey. And so we have to remember that some have fled war, torture, or state violence only to find themselves controlled again by someone who should be their partner. And so when we take a look at some of the barriers that reinforce that abuse from someone just simply getting help, we have to think about the language barriers. That may prevent a survivor from even calling a hotline regarding legal documents or even understanding their particular rights. The fear of deportation is often a direct tool of abuse. So a partner may say, if you report me, I'll report you. Or worse, you'll be sent back and they'll take the kids away. Survivors may actually lack access to culturally competent providers, meaning that they fear being misunderstood, judged, or even blamed for the choices that they have made. There's also religious or cultural views that may pressure them to stay silent or to keep the family together at like any cost. And many don't know that they're protected under particular laws. So if one particular one is Violence Against Women's Act or VAWA, if you've ever done those types of assessments before, and that provides options for those without legal immigration status. All of this makes it very difficult for survivors to disclose abuse and even harder to leave. Okay, and so I want to ask this question. How many of you have actually heard of the power and control wheel? Okay, great. So it looks like a great deal of you have understood and have heard of the power and control wheel. Okay, we have a couple that have not. That's fine. All right, and no worries. We're going to go through how this will can be applied when it comes to working with our population. When we think about this population, the question that we ask is, how do we apply what is the power and control wheel? So this is where the power and control really becomes a valuable tool. It was originally developed in 1980s by the Duluth model, and the wheel really does illustrate the various tactics that abusers use to dominate and control their partners. It includes behaviors like intimidation, isolation, economic abuse, using children, minimizing, and blaming. But this is key for us as providers. We have to apply the power and control wheel with cultural and trauma-informed awareness. So, in the case of working with refugee and migrant survivors, abuse isn't just physical, it's often deeply entangled with a person's immigration status, their legal standing, or isolation from support networks. And I want to take a look at a couple of examples. So, immigration related threats. So, again, a survivor might be told, if you leave me, I'll call ICE. Or you can't go to the police, they'll deport you. Again, with the language isolation, abuser may prevent the survivor from learning English or from going to appointments unless they present as the translator. So they're kind of like controlling the flow of the information. There's also the control of documentation. The survivor may not have access to their passport, visa, or even their children's paperwork. And this puts them at a legal disadvantage and increases that fear. And then there's finally the spiritual or cultural shame. So in many cultures, disclosing abuse is considered dishonorable, and survivors may feel, have that fear of being cut off from the community or judged by the elders or disbelieved if they actually do speak up. So all of these tactics are forms of power and control. And the more isolated a survivor is the more effective that the tactics actually become. Okay. And so, what are some cultural nuances in defining abuse that you should be aware of? And so, like, what cultural differences should you understand when defining abuse? Okay, we're seeing religion. Anybody think of any other things that we should actually be aware of when we're thinking of kind of that definition of abuse? Yes, roles of men and women. Yes, gender roles. Yes, these are all excellent, excellent responses, things that we have to, consider when we're thinking about this, when working with different population. Yes, the honor and shame cultures. Thank you so much, everybody. You're giving some great, yes, age is another one as well. How common it may be in their country. These are all great responses. All right, so now let's talk about how culture really does impact the recognition of abuse. So some survivors may not see what they're experiencing as abuse because they've never actually been shown a different model of like that partnership. So let's say, for example, if you've been grown up in a household where men make all the decisions, where physical discipline was normalized, or where silence around conflict was expected. So in some cultures, family matters are strictly private, and discussing them, even with a professional, like you or everybody here, can be considered betrayal. So survivors may not want to bring shame to their family or risk that community backlash, and they may worry about actually speaking up will ruin their children's chances or bring attention from child welfare or be used against them in like an immigration related hearing. So really understanding this context doesn't mean that we are excusing the abuse, but it does mean that we actually approach the survivors with a deeper cultural humility. And we must create a space for them to actually name their experiences in their own words at their own pace and without that fear of being judged or forced to act before they're even really ready. So when we ask that question of what is really our role as providers, as healthcare workers, what will we do in this particular role? And so, as our role as clinicians, social workers, advocates, or professionals, we really are there to hold two things at once: a commitment to the survivor, their safety and anatomy, and a respect for their cultural framework that may shape how their safety is defined. We must be careful not to actually assume that all survivors want to leave their abuser or that leaving is always the safest option for them. So for someone without immigration status, income, language skills, or family support, staying there might feel like their only way to survive. So instead of asking, why don't they leave? We need to ask, what are the risks if they leave? And what support do they need if they stay? Okay, this is where that collaborative safety planning comes in. It's not about just getting someone out of danger. It's about helping them think through the options in a way that honors their autonomy and their cultural identity. So, to truly serve refugee and migrant survivors of domestic violence, we must move beyond just kind of this checklist process and, scripted interventions that we have learned. We got to listen deeply, reflect often, and remain open to what safety looks like for each particular individual. And so, as we continue on this training and we'll build on this foundation, we're going to look at specific trauma informed strategies and engagement methods that really promote that safety, dignity, and empowerment. And most importantly, we'll explore how to shift from bringing service providers to being trusted partners in a survivor's healthy journey. Okay, so I want to ask a question. Approximately how many adults in the US experience physical abuse by a partner each year? And just you can, I'll explain it later, but what are your assumptions? What are your thoughts? How many you think really do experience physical abuse by a partner each year? So the answer is actually C, 12 million. So the data does show that domestic violence is really, it's widespread. So nearly 12 million adults are victims of physical abuse each year. Even more common is emotional or psychological abuse, and that's affecting nearly 5 in 10 adults, regardless of their gender. And these statistics really do highlight just that urgency of integrating universal screenings and trauma-informed interventions into everyday practices. All right, so something that a lot of people do get confused about, and I just wanted to put this in here, is the difference between DV and intimate partner violence, which we call IPV. So DV covers violence across all family or household relationships. So this can include parent-child abuse, elder maltreatment, sibling aggression, and even caregiver violence, where IPV refers specifically to abuse within like a dating or marital or current or former romantic relationships. And that really does make IPV a subset of DV. But when working with immigrant and refugees who may live in like an extended household, using the broader term of DV is often more appropriate. And it encompasses abuse from an extended family, cultural practices, or household dynamics beyond just the intimate partner, helping us avoid any missing cases. So it can involve, DV can come from all family members. And if you just use that main umbrella when describing it and talking to clientele that you're working with, you'll be able to get everybody under that umbrella. Okay, so we talked a little bit about the power and control will earlier. So we'll focus on really how its patterns appear when we're working with refugee and migrant contexts. So domestic violence in these communities is often shaped by that cultural norms, the trauma histories, and the immigration stressors that I talked about earlier, like the language barriers, the legal fears, and limited access to support. So our task as providers is to recognize those both visible and the hidden form of control, especially those tied to that dependency and that fear of the legal consequences. So we're going to go through each part of it. All right, so first we have using intimidation, or intimidation is the overall section. For many survivors, intimidation does start subtly, like slamming of the doors, breaking items, a certain look, or a threat left lingering. But in migrant and refugee population, it often includes threats to call immigration services, ICE, or harm family members who are abroad, right? So when someone is familiar with their rights or the law in a new country, even empty threats become paralyzing. And abusers really do exploit that fear, often without even lifting a hand or doing anything. Okay, and then we're going to talk about now emotional abuse. So, emotional abuse really slowly erodes a person's sense of self-worth. This might sound like you're worthless, no one else will want you, or you're too stupid to survive here. In many cultures, survivors may not label this as actually abuse, especially if they were raised in like environments where emotional cruelty was normalized or really, minimized. So our responsibility is to name it gently, affirm what's happening, and help them rebuild their internal narrative. And next part is isolation. And isolation is really one of the most potent tactics in immigrant abuse cases. So we see many survivors are brought to the US or another country with no family or support network, right? And so the abusers will forbid them from working. They'll monitor their phone use. They'll deny them to get English classes or restrict them to a single community that they control. So the abuser controls that particular community, a close friend network, or even their particular family. And so isolation becomes both physical as well as psychological. And they may not even know that the resources really exist or that the abuse is something that they can actually report. Okay. Minimizing, denying, and blaming. And this is a set of behaviors that reinforces that confusion. So survivors are told it's not abuse, it's discipline. Or you're too sensitive. That's just how men talk in our culture. So these phrases really kind of blur the line between cultural practice and abuse. Many feel deep guilt for betraying their culture or community by seeking help. And as providers, we must walk carefully here. So you're going to use questions like, does this behavior feel safe to you? Or how does it affect your sense of self, to kind of shift that power back to the survivor? Okay. Using children. So children are often used as leverage, especially when legal custody is uncertain. So threats may include reporting the survivor to CPS, denying them access to their children, or threatening to send the children abroad. Another common tactic is using the children as translators. This places that enormous pressure on the young ones to keep the survivor dependent. So when the child understands more than the parent, the balance of power shifts in the household. And we must be mindful of these layers when working with this clientele. Okay. Male privilege is mentioned on the wheel if you get the basic power and control wheel, but I like to call it privilege or entitlement as well. And this tactic really just shows up when the abuser claims cultural, religious, or legal superiority. For example, I'm the husband, I make the rules, or the Quran Bible says that you must obey, or in our home country, this won't even be a problem. So while cultural values um, vary, abuse is never excusable, right? And our challenge is to really affirm that cultural identity without excusing the harmful behaviors. So we can say, I understand that tradition is important to you, and also I want to ensure your safety. So you're not minimizing their cultural beliefs, but you're checking to see how they feel about their safety in this moment. And economic abuse really does come under financial control. And this is especially dangerous when survivors rely on the abuser for immigration sponsorship. This can include like denying access to bank accounts, forbidding employment or education, or taking their government benefits meant for like the entire family. Survivors may not know that they're allowed to open like their own bank account or apply for benefits like independently. Economic abuse does trap the survivors in kind of this cycle of need. And to help them identify what they can control financially, our biggest thing and role that we can do is to offer culturally competent referrals. All right, so with coercion and threats, there often include statements like, I'll have you deported. If you call the police, I say you abuse me. Your family back home will suffer if you don't cooperate. So these threats work because they exploit that fear, that trauma, that cultural guilt. And refugees who have fled persecution may be especially vulnerable to these threats. Even the possibility of being forced back into danger is enough to keep them silent. And as providers, our role with this, when you see this happening, is to validate their fears and reinforce that support does actually exist for them, even if they are unsure of their particular rights. All right, now, before we move into the next part of the training, I really want to take a moment to summarize and give you space to just reflect, right? Domestic violence in refugee and migrant communities is very layered and complex. Abuse is not always visible, and safety planning has to go beyond just the immediate danger. It must also consider just that legal vulnerabilities, the cultural expectations, and the language barriers that really do shape the survivor's sense of safety. The power and control wheel does help us identify these patterns, but our real task is to really apply it with that cultural humility, recognizing that for displaced individuals, control often includes threats related to their immigration status, that fear of deportation, and the isolation that they're getting from the language barriers or the community stigma that can also come along with it as well. And the survivors may remain silent, not only out of fear of their partners, but because of the fear of losing those legal statuses, that community standing, and family connections. So they're layered, right? And these pressures really do often build on one another and are invisible to outsiders. And that's why cultural awareness and trauma-informed care are essential to creating that trust and safety. So as we continue on, I really want you to reflect as we go on to the next part. What assumptions might I hold about culture, safety, or abuse? How can I better serve clients whose lived experience maybe differ from my own? And next, we're going to actually watch a few clips that bring these ideas to life. So showing how the power and control can look different across cultural settings and how you as clinicians can respond effectively while honoring each survivor's background and story. Okay, so this next video, we're going to watch how coercion can impact survivors. And just as a warning, some of the topics and images in this video may cause an emotional reaction. Please take a moment if you need for time to step away. And this information is from a United Kingdom news network.
It felt like being in prison. He started telling me to hurt myself and taunting me for not hurting myself badly enough.
He eventually got me hooked onto heroin.
It wasn't until our father had killed our mum and sister that we actually realised just how dangerous control is.
Coercive control is an insidious form of abuse.
You're actually going to wear that?
For too long, it has gone unnoticed, and it can ruin lives. For many victims, it is an isolating secret they bear alone.
Who are you talking to?
I'm not talking to anyone, I'm just doing my video.
You're lying.
I'm not,
I told you not to talk to people.
Coercive control is a subtle form of abuse. The survivor may not even recognise it as abusive. It's a repeated pattern of behaviours, stripping away a survivor's self-esteem, and it can increase the isolation of the survivor in that relationship.
What's really important for people to understand is that they may not even recognise that they are actually a victim of domestic abuse.
A Mumsnet survey said 38% of women have been in an abusive or controlling relationship, with 6 in 10 saying they suspected a friend or family member was in one. Sadie is one of them. She entered into an arranged marriage at 19.
It started off with language, then it started off with how I was walking and talking. If I sat down, you don't sit down like that. You need to sit down slower than this. How you stand, you don't stand like that. I'm an educated man, you need to stand like this. And then it went on to who I was going to meet and whether I should be in contact with them. The clothes that I wore, I didn't buy my clothes. He bought all of my clothes. I knew it was wrong. I went for the phone, and this time he threatened to kill me. He said I was going to bring shame on my father. That was the last thing I wanted. My father was my life. It's hard because you don't have anywhere to turn to. And when you don't have any support, then you start believing that there is something wrong with you, that you are at fault, that you are making this happen. It's your fault that he's angry. It's your fault that he's violent. So yeah, it was really lonely. It was really lonely, yeah.
Mumsnet found 24% of the victims of domestic abuse never said anything to anyone about what they were going through.
Perpetrators are very clever. It's like a drip, drip, drip effect. Over time, your own perception of reality is diminished.
Chloe was 13 when she met her partner.
I met my boyfriend on Twitter, online. I don't know, I don't think I thought something wasn't right for like a really long time. Like it took such long because things built up so gradually. Like each thing I was just like, well, it's just another little thing. I think looking back, there were signs from the very beginning that something wasn't right. He could go from being, like, he'd be really lovely when we met, and then in between, he'd be really, really unpleasant. I think, like, there were lots of little things he did that were quite controlling. Like, he could, like, lose his temper over maybe just, like, me liking the wrong Facebook page, or, like, he'd tell me, like, he liked girls to dress a certain way. Like, he'd say, oh, I only find girls attractive if they wear, like, short dresses and, like, low tops and that kind of thing. And then if I dressed like that when I was with him, afterwards he'd like shout at me for being a slag and a slut. I was constantly like monitoring my behaviour and trying to think like, what have I done to make him think this, and what can I do to make him like stop getting angry? What am I doing wrong? And he started like self-harming and saying he stashed pills for an overdose, and he said he was going to kill himself, but that if I told anyone, he'd do it straight away and it would be all my fault. So it's all just a way to kind of keep control over you and to have some kind of power, I guess.
Okay, so you can see in that video how the power was almost continued, right? And it's very slow, subtle, dripping methods that may just seem like regular, engagements and interactions, but the powers, the control that they're taking over the person is slowly being immersed in them to the point that they feel like they're at fault for everything and anything that they do. So I want to just do a quick question to see which of the following best demonstrates abuse within a refugee and migrant context using the power and control wheel. So a partner criticizes their spouse's cooking and asks for a different meal. B, a spouse hides the family immigration papers and threatens deportation during arguments. C, a partner insists the family follow traditional cultural values. Or D, a refugee parent disciplines a child using cultural punishment. Okay, Kathy, that's a good one. All of the above is a good one because it can be picked apart, right? When we are considering the will, we look at B, right? And which is what everybody pretty much say. A spouse hides the family's immigration papers and threatens deportation during arguments. But A can also be applied, right? When we think about that privilege section. C can also be applied. When we think about like what is the cultural traditional values and how they can assist and use that as control. And D often as well. A refugee parent disciplines a child using corporal punishment. But A was the one that I was going for, but you're absolutely right. All of these can be used when it comes to the will in general. So everybody's good. You're starting to see how the will can actually be used in this context when working with refugee and migrant populations. Now, I'm going to watch one more video. And in this video here, we're going to look at another lived experience of DV survivor and when they have received help and what it looked like for them.
No one deserves to be abused. At KSAT, we spend a lot of time telling the stories of domestic violence survivors. But in Courtney Friedman's series, Loving in Fear, one group of survivors has been hesitant for years to tell their stories. Until today, migrants often feel threatened that if they turn for help, they'll be deported. Today, Courtney sat down with a brave young mother who wants other migrants to know you can ask for help.
This silly, relaxed freedom is a new feeling for these girls and their mother, who we are keeping safe by hiding her identity. Her husband is in jail on a felony charge accused of trying to kill her 2 months ago. They're both from Colombia and moved to the United States, leaving all family behind.
We know that isolation is one of the key things that an abuser does, and you feel like it made that worse?
No, pues sí fue peor. She said it was worse, a lot worse. It was physical. He would verbally put her down, and it was also sexual assault.
Magali Garcia is her case manager at the Battered Women and Children's Shelter and says her abuser often threatened to get her deported, something her staff says almost always happens to immigrant victims.
She said that was very scary because he has a lot of enemies in Colombia, and if she had to go back, then that puts her and the daughters in danger.
2 months ago, when the abuse hit a peak, police arrested him and took her and her daughters to the shelter. That's where she learned about the abuse she's endured, focused on mental health, and found a way to smile again.
She's learned that not only it wasn't her fault, but they've empowered her to recognize that she can do this on her own.
I can see in your face. I can see that.
They're already working on her immigration status and getting a work permit so she can contribute to the community that saved her life. And to any other immigrants suffering in a prison of silence, she promises freedom is possible.
She said you have to look yourself in the mirror and learn to love yourself. They tend to make you believe that you're not worth anything, but that you are.
And so you see right here, here's a firsthand account of how that isolation was utilized against her and how she was able to seek help later on. And translation and language is, again, that's one of the key ones that we see happen. So now I want to actually do another sample scenario, because, the more that we understand how to look at that will and utilize it with our population, we will understand how to help them, right? So with this one, A refugee woman on a spousal visa reports being isolated from her community and denied access to English classes. Her partner threatens to call ICE if she misbehaves, instilling that fear of deportation. And these behaviors reflect some key dynamics that we've already outlined in the power and control wheel. Which one, or if there are multiple ones that you believe that she is actually experiencing? So take a look back at the will and tell me if there's any or pieces of it that you might say, she's definitely experiencing this. And so when I'm working with her or I'm engaging with her, I can start to identify where I can help her on different aspects that she's experiencing in the DV situation that she's in. Okay, so I'm seeing isolation, intimidation and threats, intimidation. Okay, isolation and intimidation. Okay, so there's a couple different ones, right? Isolation, a lot of you picked up on that, and that was a key one. That's demonstrated through the restrictions on her social contacts and that support system. So severing ties with her community resources that can offer her any type of help or different perspective. Language control, and I think I just saw somebody, yes, you put in there language privileges. That's correct, language control. So they're denying her access to the English classes, and that again reinforces that dependency and limits her ability to navigate any type of systems, seeking unemployment, or access any type of legal related services. The immigration threats serve as a potent form of intimidation. So exploiting her undocumented fears or her status, weaponizing her legal vulnerability. So you're seeing that tactic being used. And then they're using the partner use of institutional power. So like threats of involving ICE and that legal status exemplifies that using privilege section as outlined in the will, particularly in a one partner who holds that social, legal, or language dominance over them. So again, these behaviors do not occur in isolation, but are systemically applied to maintain dominance and control, particularly against women in mixed status or dependent immigration relationships. And these tactics may actually delay that help-seeking behavior and increase that psychological distress and result in that compounding trauma. So this especially happens when the survivor has limited access to that culturally and linguistically appropriate services. So now that we've gone through and kind of understood the will, we talked about the different sections of the will, we've seen some examples. What are some practical strategies that we can do and that we can use when working with the population? And so again, as providers, and you'll hear me say this a couple of times throughout this, we have to go beyond just awareness and apply intentional strategies that support immigrant and refugee survivors of domestic violence. So first, it's very important that you use tools that reflect the client's cultural and linguistic needs. The power and control wheel that we showed you, there was a couple different ones. There is one that's strictly for refugee and migrant population. There's one if you're, in a westernized relationship, but it's also available in more than 20 different languages. And so it makes it easier for clients to understand the dynamics of abuse in a culturally relevant context. Second, if you work for a particular organization, it's really important that all staff are trained to recognize immigration-related control tactics, such as threats to call ICE or withholding documents or isolating the clients from like English instructions or services. And so if it's acceptable in your program, we really do recommend like linking or connecting to DV training organizations that do provide free modules. And we'll also talk about at the end, we do have resources as well at RMTAC that you can go through and see different services also. And third, continue to like build partnerships with immigrant serving organizations is really going to be essential. So again, collaborating with culturally specific community groups can really increase that trust, that accessibility for our clients, and that continuation of care. And again, like I said, in the RMTAC directory, you can find some groups that have already been vetted and reviewed or explore like national directories for culturally responsive DV service providers. And lastly, remembering that safety planning must account for immigration risk. So for example, some shelters may have requirements that complicate access for individuals that might be undocumented survivors. So you want to be sure that you check those resources and options to see what they have in place. And I want to close out with some common mistakes that we may see happening when working with the population. We cannot view it as a one size fits all approach when it comes to domestic violence. Assuming that DV looks the same across all cultural groups, one major mishap is using that westernized lens when assessing abuse. In the US, DV is often framed around physical or sexual violence, but in many cultures, again, that control can be exerted through family pressure, dowry systems, honor-based restrictions, or control of travel, religious practices. And they may not be labeled as abuse by that survivor, but can still cause them deep harm, right? Overlooking immigration-specific forms of coercion. So again, that failing to recognize that that corrosive behavior can be tied to the immigration status. So those threats of deportation, the document withholding, or even the sabotaging of the visa application. So not, going to their appointments or submitting the application and submitting missing documentation on purpose. And these tactics really do exploit that legal vulnerabilities that many survivors really do fear reporting. Failure to use interpreters or a cultural broker. So language access is not optional. It's essential. And so survivors may not fully really understand their rights or their resources without an interpreter there. Even worse, it can be if you use their child as a interpreter or their partner as a translator. That can re-traumatize them, and it can be actually very unsafe. So I really recommend that you connect with a directory of cultural brokers or multilingual advocates. If your particular agency doesn't already have one, you can look at the resource link that RMTAC has. That may have some resources there as well for you. Misusing the power and control wheel without context or translation is the fourth mistake that we see happening. So while the wheel is a powerful tool, without explanation in the wrong language, it really does diminish its impact. So you want to always explain the cultural relevance and really ensure that it's translated appropriately. And again, like I said, the versions are available in 20 plus languages. If there's a language that's not there, and you have a client that really needs to understand the power control wheel, if you reach out to the main DV center, they will provide that language to you. And finally, this is also really a great time to consider how your team or agency might contribute to directories like RMTAC as well, and which help connect survivors to culturally informed providers. And we'll share that later on how you can be connected to it. Okay, and the next slide is going to show some of our references to this research as well. And also the final slide, or not the final slide, almost final slide, is information about RMTAC. We are here to help. As you can see from this particular training, if you feel that you need a training for your organization, you can submit a CTA request on the RMTAC website. And if step one is you navigate to rmtach.org, you see that little blue box there. You can click to request a consultation and technical assistance button, and you can just fill out that CTA form so that we can give resources to you. And finally, I really want to thank everybody for coming today. Next, we have the Q&A session. So if you have any questions, somebody also talked about the interpreter from local community could also be an issue out of fear. Yes, that is correct. You can also, there's a lot of different organizations. Sometimes colleges have interpreters as well that they have to get a final presentation. You could reach out to a college and they might be able to come in. If you do use an interpreter from other organizations, just make sure that they're vetted. Make sure that they are trauma trained. If you're going to be using medical terminology, make sure they're also trained medically to be able to communicate with the person. And so definitely make sure that you get those resources. Okay, I'm going to go through the chat area. And while I go through that, Esther, if you could show the next slide, which is the closing reminder for our survey, I really would appreciate if everybody could fill this out. Any feedback and responses, we appreciate to get. That helps me. That also helps RMTAC to know what other trainings that we can offer. And while everybody takes a moment to scan that code, and I think Esther will also put it in the message area as well. I'm going to jump through and see if I can read off some of your questions. Okay, so one question I had in other trainings that using a culture broker can sometimes expose a survivor to fear that knowledge of abuse could spread through their culture community. So yes, Katie, so it dependent, you're gonna have to vet the cultural broker, right? You're just gonna have to make sure that if you do find one, they may not be for their particular community. You might find one from another community that does speak their native language and that can be there for you. Migrating is just making sure that you vet them. You ask them questions. You make sure that they're actually a person that is properly trained. You can also have them if your organization might have they can't respond or talk about them openly, a contract that they may have to sign. You could do that as well. But there's a lot of different areas where you can have somebody there that can be a support system that's not directly connected with them. And I would also ask the client if it is a person that they know or if that they have engaged with, or if it's a community that they have ties to as well. The biggest thing is just being open with the client and just asking them those questions. Let me see. Do you have any tips on how to balance allowing the space needed by the survivor to tell their story with the time legal constraints the provider may have, submitting an application or personal declaration of time for a deadline, hearing the legal case? So I would say you want to also, when you're thinking about this, if you're talking about like in legal cases, like if you're an attorney, Kathy, and I think that might be what you're saying, I would always try to chunk up the time. It's always best not to re-traumatize the client when they're sitting there and telling their story. I do understand that limited time. If you can try to get the basic part of it, or even do a referral out to a clinician that might have more options of time. Trauma is real and the re-traumatization can happen when they're telling their story. It's always best to try to get it in small chunks and also offer that self-care resources for them later on. I'm not sure if you're talking about illegal. Okay, so Kathy, yeah. So if you're doing like a VAWA case or U visa, T visa in that essence, it can be very hard to get it. I would probably suggest reaching out to another clinician that might be able to work with you on those particular cases, and then use the written documentation from that to maybe help you with their story. But you have to be very careful not to re-traumatize them. And I know for your instances, that's very difficult because you're working in a legal format. But I can also follow up with you and give you some more resources as well. If we make sure we get Kathy's email on some other tactics and things that you could try to do also. Okay, so Maddie, when having discussions with folks who are survivors actively experiencing abuse, risk of deportation from ICE, what encouragement resources can you offer them? Are you any resources that is a reality situation now? Okay, so Maddie, it's a really good question. I think that for definitely in the current client, I want to make sure I provide you with the most accurate information. So I'll follow up with you after the session once I confirm the details of what resources are actively offered to them. Definitely, you're going to try your best to just be there as a ear for them and a support system. But I want to make sure that I provide you with the correct information that is active and current. So definitely we'll follow up with you. So when they do reach out for help, you just want to continue to empower them and provide support to them. You have to take it slow with working with refugee and migrant population and not always assume that the things that have worked at westernized topics will help them. What I've noticed that with refugee and migrant clientele, the biggest thing is giving them education, but in smaller chunks, and asking them, you're trying to get the power back to them. So you're going to ask them, what works for you, right? How has this impacted you? How do you feel? What do you think is best for you? And allow them to kind of get to the part that's going to make them feel the safest. In a westernized viewpoint, when a lot of clinicians will sometimes just automatically assume I'll give them all of these things and this is going to work. But when you're working with a person that's already in a fragile state, that's not always going to be there. They have to build that trust. So they have to first start off with that trust with you. And if they don't feel like they have that trust in the beginning, they're not going to listen to pretty much anything that you say afterwards. So providing them first with that trust and that empathy, and then giving the control back to them in your just automatic conversation that you're having with them, asking them how they feel. It's a lot of putting them into almost a state where they're controlling. If you're doing therapy sessions, they're controlling the session. If you're not doing therapy sessions, you're working with them one-on-one. They are in control of the next steps of their future, but you're not putting a lot of pressure on them, because once you do that, they're going to feel fearful and they're going to go. They're going to run. Please make sure that any closing reminders, you can complete the surveys and submit a CTA request. If you put questions here and I didn't get to them, you will get a follow-up email from us as well. As long as you make sure that you signed up for everything and we have your email here, we definitely will do that. And then there's an email address for RMTAC to contact us as well for any other questions that later on you might be like, oh, I forgot to ask this questions. Here is the email that you can reach out to us for any questions, and we'll give you some feedback. So thank you everybody for coming today and being a part of this training. And please make sure you sign up so when we do future trainings, we can put you on the list.